Hello, my name is Yuming Chang, and I'm excited and pleased to introduce to you the Diagnostic Radiology Residency at Beth Israel Deaconess Medical Center. We are a Harvard Medical School affiliated teaching hospital and the third largest hospital in the Boston area. Our institution has a long and storied history in radiology. Just to name two pioneers, Dr. Felix Fleischner, one of the fathers of chest radiography, and Dr. Morris Simon, the inventor of the Simon-Nightingale IVC filter. We offer the best of both worlds, with a combination of high volume and high acuity clinical training and amazing research opportunities in our department and through affiliations with our Harvard sister institutions. Of the four largest teaching programs in the Boston area, we still offer independent night float, and our residents are known for their autonomy and confidence that this instills. Our trainees are highly sought after and regarded by fellowships, and they excel in both the private and academic environment. In fact, a number of our past residents are now department chairs. But one of the greatest things about BIDMC radiology is the sense of camaraderie and the caring culture that exists from the residents all the way up to the chair of the department. I was a fellow here myself, and so I enjoyed working with the residents and the incredible mentors I trained under that when I was offered a job here, I didn't even think twice about accepting. And I know that I'm not alone in my opinion, because nearly 50% of our clinical staff were either residents or fellows here.
Hi, I'm Eddie. I'm one of the second-year radiology residents. One thing that really stood out to me with the interview day at Beth Israel Deaconess was definitely the overall warm sense that I got from the program through the faculty who I interviewed with and all the residents who I interacted with throughout the day. Everyone just seemed very friendly, very kind, very welcoming. Having now been a part of the program for 2 years, I can definitely attest to that. I think one of the greatest aspects of the program is definitely the camaraderie between the residents. When we're in the hospital, we work hard. It can get pretty busy, but we're all there for each other. We support each other, help each other, and we kind of get through things together. And outside the hospital, there's always things going on. There's things being planned. Boston's an amazing city, so it could be catching a Red Sox game after work or grabbing dinner with a few co-residents. There's always things being planned for us to do. I think for me personally, when I moved to Boston, I didn't really know anyone. I didn't have any friends or family in the area, so definitely having this really tight, close-knit group of residents who I can kind of rely on both in and outside the hospital has been invaluable and has definitely made residency a very enjoyable experience.
Hi, my name's Katie Van Schaik, and I'm an R1 or PGY2 here in the Diagnostic Radiology Residency. I'm also an American Board of Radiology Holman Research Pathway resident, which means that I have protected time as a part of my residency to pursue research projects. I've been here in Boston for a while. I did my undergraduate degree at Harvard College, my medical degree at Harvard Medical School, and my PhD at the Harvard Graduate School. And in the course of that training, I was able to rotate through all of Harvard's teaching hospitals. And I noticed a few things that really made it a great choice for me. One was the institution's overall emphasis on education. And that's something that is certainly a part of the Diagnostic Radiology Residency program, but it's also a focus of the hospital and the institution as a whole. And that's something that I think is very important for not only residents, but also for medical students and for faculty. It's a commitment to education, to teaching one another, to learning from one another, and to continuing to do that, not only during training, but after training as well. I was also really impressed by the availability and the visibility of the residency and the department's leadership with Dr. Kruskal, Dr. Wu, Dr. Rawson, Dr. Sievert, Dr. Chang, and the section leaders. They're available, they're interested in residents, they care deeply about the residents and their education. And that was something that I found very powerful about this program.